Good morning. I'm Sid, and I'd like to introduce you to Luminate Health. We give labs a digital platform for their patients to access and understand their lab results. This is a lab report. This is what patients typically see if they ever see their results at all. So not only do you have poor access to your important medical information, what's scary is that 60 to 70% of critical decisions about your health are based on these results. So at Luminate Health, we re-envisioned lab results for patients so that they get easy digital access and they can start to make sense of what the results actually mean. But while the patients are the primary users of our product, the labs are our customers. And starting October 6th of last year, every lab in the US is now required to provide digital access to these results directly to patients. And moreover, labs in this largely commoditized industry are aggressively looking for ways to differentiate their services. And as healthcare becomes increasingly consumer-driven, they have to develop a more direct relationship with their patients. So the Luminate Health system or solution for labs actually consists of three components: the patient application, which you just saw, a provider application, and a lab application. And together, they allow all parties to stay connected on a patient's care and a lab to ensure that they're delivering the right services to these key stakeholders. So ultimately, our service benefits labs by helping them to improve patient care, improve patient loyalty, increase physician referrals, and avoid the cost of having to build a legislation-compliant system themselves. This was an $80 billion market last year, and it's growing. And the two biggest groups here are commercial or independent labs and hospital labs, which together account for about 95% of the market, and that's where we're focusing our attention. And here's how we've built our business model. We charge labs a base monthly service fee to process up to a certain number of tests per month. We then charge additional fee tiers for tests that we process above that. So in a lab market with about 8,500 or so lab businesses, our base addressable market, counting only the base tier as a revenue source, is up to about $1.4 billion. And this model itself is a key point of differentiation for us because it allows us to capture an enormous volume of extremely valuable health data. And today we count a number of top 150 commercial labs as our customers, and more importantly, since Q4 of last year, our overall customer pipeline more than doubled and now includes not just commercial labs, but hospital labs and channel partners as well. We're a co-founding team of 3 serial entrepreneurs with experience ranging from healthcare product development and strategy to software engineering to sales. And in advance of a Series A later this year, we're currently raising about $500K to capitalize or actually to accommodate the rapid sales acceleration we've seen over the last few months. If you'd like to learn more, come and talk to us. Here's how you can do that. Thank you very much.
Thank you, Sid. All right. Yep. Let's start with Garrett.
Thanks. I really like the business model of. Here's a first question. Do the users actually use it, and do you care?
So we do care. We don't expect that we'll get, for example, 75% user adoption, but what we're already seeing is that the user adoption is 4 to 5x what typical patient portals get and growing. And where we do care is actually where users are, for example, more frequent users of testing. So as of today, just over 50% of our active users are over the age of 50, and a fair number of those, or fair percentage of those, are actually over the age of 70. So that matters to us. But in general, because we are delivering a service to these labs, the user adoption rate doesn't need to be 100%. Or 75%, something like that.
So the follow-up question is, what is the most difficult question that these labs are asking you when you're in your sales cycles, and how do you answer?
So the lab market is kind of a very old school industry, right? And so if they're used to delivering a paper report or only delivering reports to their physicians, so we're still learning that some of these labs don't know that this legislation exists. So the question we get is, okay, so why do we need to develop or why do we need to deliver kind of enhanced reporting? And we're starting to see some turnaround, particularly from the larger labs, and then the medium and smaller labs are starting to come around and starting to become aware of this. But that's typically turning over a really old school industry can be challenging. Yeah.
I've got a follow-up question in the same pathway. So you're thinking the same way I was.
Sure.
This is going to be how many downloaded customers do you have, or users, and how many are active, and what percentage is that of the potential customers?
Yeah.
And then second part is, what about Europe, rest of the world? It's a very different regulatory structure. Is there an international opportunity at all, or is this just a U.S. business?
Sure. So in interest of our company, I'll share that information on the first question with you offline. And the second part is
Like it's not good then.
No, it is good. It is good. And the second part of that is we absolutely do have international opportunities, which we just have not been able to attack yet. So we've gotten interest from China, India, Mexico, Brazil, countries in Europe as well. We're just at a stage where we can't accommodate that just yet. But our user adoption numbers are actually very good.
So hey, Sid, so good to see you again. I've
to
been
see you
following
again
you
as
for
well.
a while. So two things I just want to make clear to the audience. I was at Google and we tried to do something like this with Google Health. It's a different time now. Patient experience, patient satisfaction, and transparency are big in today's market. And there's a lot of sort of larger corporate chains that are looking for this. The biggest number one change that's happened during the birth of your startup is that Health and Human Services came out with a law that said, we will override all states that have individual laws around direct consumer access to your labs. That has completely changed your business model.
Absolutely.
So today, the reason why you're accelerated in your sales pipeline is because you are breaking the law if you cannot give consumers direct access to their labs even before a doctor views the labs, except for certain specific sensitive diagnostics. So this is a very interesting business model now. My question to you is, if you raise the 500,000, what are your three biggest growth areas in your company right now? Is it direct sales? Is it product development that you need in order to get to your Series A?
Yeah, so it's three things. One is direct sales, because we do want people who actually have experience selling into these three kinds of labs that we're looking at. It's the customer implementations, they are costly, and in the early stages, sometimes we do them on site. That we wouldn't scale that, but in the early stages, those can be costly, and so on that. And of course, on the engineering side, as we continue to make improvements and build on our product. So those are the three areas we would use that for.
So clearly there's an appeal to the market to have a data visualization and a submission for consumers. For it not to become a commoditized service at the end of the day or a pennies per result, are you thinking about other ways to engage the consumer, and do you think you'll ever monetize the consumer in that lab portal in some way?
So on monetizing the consumer, we have not approached that yet, and generally, I mean, we've done a lot of research on this. Consumer willingness to pay is generally pretty low around health-related stuff.
I'm not thinking about them paying for storage, but things like vitamin D supplementation when their D level is low.
Yeah, so actually that leads into another place that we're looking to do next, which is we've talked to a number of specialists who've said, hey, what would be really powerful is if you can start weaving in, for example, medication information or supplement or vitamin information there.
Coaching.
So yes, exactly. So that's where we can start to add value. And again, I mentioned the other part is that we're capturing a large volume of this data. So what we can do on top of what we're already doing is start to personalize this information for the individuals. Over time, as we start to aggregate kind of a large volume of data, there are plays that we can make in population health. And then, certainly less sexy, but with the lab organizations that we're working with, there's almost a CRM-like service that we can give them with the data that we're already collecting.
What are your data usage rights when you contract with the labs, in terms of doing analytics or population-based
Yeah, so
studies?
when we structure our contracts, we structure that so that we can actually use the data on an aggregate basis, de-identified, but we structure all of our contracts so that we actually have rights to that data.
Nice job.
Thank you very much.